as with any diagnostic test, the two important variables are how sensitive is the test and how specific is the test. And when you're making a decision to treat, the test needs to be specific, meaning it needs to, a positive test, you need to feel very comfortable that patient has the mutation. And so the tests that you mentioned, the COBAS test and the THX-ID test, those are the BRAF tests that were developed as vemurafenib and dabrafenib were being developed. So 10 years ago, when you were diagnosed with metastatic melanoma, you didn't send your tumor to Foundation Medicine and have lots of analysis done and a report that comes back a week or two later saying you have a mutation in BRAF and it's at the V600, it's at the V600 position, and it's a V to an E or a V to a K, and then it gives you a list of all the FDA approved drugs and then other clinical trials. So that didn't exist 10 years ago. What existed were clinical trials that you could enroll onto and to see if you had a BRAF mutation. If you did, you could get a BRAF targeted therapy. In those scenarios where there isn't a standard test, you have to develop a test that adequately allows you to feel confident that when you're treating patients with this drug on this clinical trial and ultimately as a commercially with standard of care and using commercial drug, that assay is really identifying patients that have that mutation. So both Roche Genentech and I guess it was mostly Roche at the time, Roche and GSK, who was developing dabrafenib, came up with their own assays that identified BRAF mutations, and those assays made it all the way through to the approval of the drugs and became companion diagnostics, meaning that all the clinical trial data up until the FDA approved the drug was with that diagnostic. And so if you were positive for that, based on that diagnostic test, that was the confidence that you could have, was based on sort of the clinical data. Not that we want to jump into all what a companion diagnostic is, but that's how those tests are. Those are PCR-based tests. They can be done in any lab. The lab should be CLIA approved, meaning that it has a certain certification that says that they run tests in a way that the FDA and the pathology groups and laboratory groups say is the way we need to make sure that the sample that comes in is the sample that we want to test. It's from the patient we're saying it's from, and that the results are as good as any laboratory can do. So it's just a designation that says you can trust this test and use it clinically. So those assays can be done in basically any CLIA approved lab. The COBAS test is actually very good at identifying V600E. It's not so good at identifying V600K. And the THX-ID test is very good at identifying both V600